The Knowledgeable Provider podcast is intended primarily to entertain, also to inform, but it is not a substitute for actual medical training and should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, please make an appointment to see your own knowledgeable medical provider. The opinions expressed by me and anyone else who happens to appear on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than the lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. Look, this is all for fun, okay? Don't sue me. All right, on with the show. Hey, welcome to Knowledgeable Provider. I'm your host, Jody Marks. This episode is actually an episode of another podcast that I was asked to be a guest on. I was asked to sit in on a panel discussion on gender roles in nursing for an episode of the Crossing the Streams podcast, which is produced by Calhoun Community College here in Decatur, Alabama. The hosts of that podcast are Dr. John Gaines, who is a professor of history, and Dr. Sheila Byrd, who is a professor of English. The third person on the panel is the other guest, Dr. Stacy Powell, who is a nursing instructor, was one of my nursing instructors, actually. I think we had a pretty interesting discussion. Of course, I'll put a link to the Crossing the Streams podcast, which you can find on Spotify in the show notes. And that's really all there is to say. I hope you enjoy it.
Hello, everybody, and welcome to this week's episode of Crossing the Streams. I'm Dr. John Gaines.
And I'm Dr. Sheila Byrd.
I'm Dr. Stacy Powell.
And I am Jody Marks.
Cool. And what do you guys do?
Well, I teach in the nursing department here at Calhoun and have been here since 2008.
Okay.
And I'm a family nurse practitioner here in Decatur and I guess you'd say an adjunct instructor in the nursing department. I show up and lecture at times.
Okay, neat.
Very, very cool. Something like I kind of wanted to sort of steer this episode toward gender in nursing because as a historian, we see some really, really interesting changes over that, over 2 centuries. And something that I've noticed outside of nursing, as a person outside of nursing, I don't know what that is.
A non-nurse, John, a non-nurse.
That's cool. Maybe over the last 15 or possibly 20 years, we're seeing more and more male nurses, which I think is honestly really, really cool. But we're seeing more and more. What's kind of the percentage do you guys think that we're sort of sitting at maybe?
Well, like you said, there's been like a steady increase over the last 20 years of males entering the nursing profession. The latest stat that I've seen is in 2021, our male numbers were 13.3%, which is about a 7% increase since 2008. So we are seeing increases there, which is a good thing. Some of the reasons that males are choosing to go into nursing now is because of, educational opportunities, because of the benefits that the job and the organizations provide, and also because there is just lots of available positions out there for nursing now. And that's even going to worsen over the next several years as some of the baby boomers, of which I'm one, will start to retire from those professions. And so the need is great.
Okay, I have a question about something you said.
Okay.
What do you consider really good benefits? Or what do you think people consider good benefits?
Well, I really think that one of the main benefits is pay is pretty good.
Okay.
In comparison to other jobs. Now,
Yes.
you're never going to find somebody who thinks they make enough,
Right.
Right.
However, with the scope of the practice, it's pretty good in comparison to other jobs.
Okay.
Other benefits is, if you're working for organizations, they have, good retirement. They typically have paid time off, vacation, 401ks, LMNOPs, whatever those are called, retirement benefits and things like that. So, and I really, one benefit in ways why a lot of people go into nursing is just the joy and the patient and the satisfaction that you get from doing that job.
Yeah, I understand that. And that makes sense. I mean, most benefits are about what are you going to get paid and what's retirement going to look like and what's vacation. That makes perfect sense. But I do understand because I get that feeling about my students, and I know you probably do too, and I know John does it. When you have students that you really, really want to help, you feel good when you're able to help them.
Yes, absolutely. Absolutely.
So that makes total sense.
Yeah.
And something that we talked about before we started recording today is once you get in there, you can go into a position and then segue all over the place with a little, some extra training and things like that. You can end up in a vastly different place than you started.
Sure. Jody is an excellent example of that.
Sure. And that's a huge advantage of nursing in general, too, that I would say is a benefit is that in general, you don't have to have a lot of extra training, like you were saying, to jump between areas. So if you get tired of one thing, you just move to something else. And there's a lot of job security involved too, because anywhere there's anything happening medically, there are nurses there, whether it's the traditional roles we think about or more administrative or more even insurance based, not even seeing patients. So it's a great field for all of those reasons.
Yeah. Well, that's great.
Cool. Well, I thought I would kind of start us off sort of taking a historical take on this. Something that we today we sort of think it's getting better, but we sort of think about nurses as a female-dominated profession. And prior to 1863, in the middle of the Civil War, nursing is absolutely male-dominated. You don't really see but a one-off female nurse. You just don't really see that. And one of the reasons at the time is that women are thought of as being extremely, extremely fragile. Women do not have very high constitutions. If they're seeing patients that have a traumatic injury or a serious disease or something like that, the thinking at the time, prior to 1862, 63 is that women would just faint. Like you're just going to pass out if you run into something like that.
Can I just chime in here because, that irritates me.
I'm kind of
it's very irritating because I think I want to see anybody have a baby and still be fragile.
Oh, we know this is totally not true. We are the wimps. Like there's no question about that.
I know that, but I'm just saying that's just an odd thing to think about women who are having childbirth at home with no help of medicine or anything. And I think, why would you think you couldn't see some blood or see some wounds or whatever?
It was just the attitude of the day.
I know it was. It's just irritating.
Nurses that were female back in that time were considered loose women.
Yeah, they were
That's exactly where I was about to go.
Yeah, they're sort of like prostitutes.
Yes.
Because that's the profession where women are seeing men in various states of undress and various body issues and possibly some kind of healed injuries and things like that. And so if anybody was a nurse, you suspected their morality a little bit.
Yeah, exactly.
So before we move on a little bit to that, I did want to kind of highlight, Jody was talking about us being the wimps. I hate this about myself, but I really, really want to donate blood so much. And I used to live in Germany. And so for the longest time, I couldn't until the Red Cross relaxed that. And now I've tried to donate blood twice, and I try my hardest to absolutely go unconscious. Like every time I'm sitting in there in their blood mobile outside of MSA, and I am sitting there trying to just pass out, and there's students all around me, and I'm just like, yeah, here we go. and it's crazy to think that, that we are the ones that are not supposed to faint, and we're not supposed to pass out. We're supposed to be these manly men.
You just can't pin that on anybody though, because honestly, I've never had children, and I probably could not. I would be so beside myself to think I had to have a child. But also, I'm bad. I told you when you were talking about popping your knee back in place or whatever, I'm pretty sure I would have fainted, because Mitchell, we had to pop his shoulder back in place, and it was a doctor doing it, and I was standing close to it, and I went, I've never fainted, but I thought, oh, I'm going to, but I didn't.
That's rough to see, though, too. And
here, and especially with somebody you love.
That's
It's
right.
like, ooh, yeah, that's right. Yeah,
And I think everybody in medicine will tell you they have their thing, that they just don't. A lot of people don't do well with suction, suctioning secretions out of things, or bones grinding, that kind of thing. Even people who work in the field have things.
Yeah, they have things that don't settle,
But they still have to do it.
They still have to do it.
Yeah, see, that's the difference in me and them. Because I'd be like, no, I'm leaving.
That's wild. I thought that,
I know.
I'm lumping y'all together, but I thought that you guys would just kind of get just immune to whatever.
Just over it.
Well, I think you get better at it.
Okay.
You do get better at it, but there are certain things that, you still do it. And it's like we teach our students, you put your nurse face on, you take care of what you need to take care of, and then you can make the faces, in the break room. Not with your patient and things like that.
Yeah, that's really good advice. It's sort of like when you have to use your teacher voice.
That's right. Yeah.
Gotcha.
Yeah.
Sure. Yeah, you definitely don't turn into a machine when you get medical training.
Yeah.
You just sort of learn to deal with the emotions.
I just really thought y'all just weren't as queasy as me.
Yeah, that's
because I can't handle somebody throwing up. I'm just like, oh, leave me. I got to get out of this room.
Yeah.
And a part of that too is probably the reason I didn't have children, because I'm like, well, there's a lot of leaky stuff.
That's a medical term, leaky stuff.
Yeah, thank you. I knew you would understand that. Thank you for knowing that medical term.
Getting back to the loose women.
Sorry.
Of course you want to go there, John. John's ready to get back to the loose women.
Absolutely. What is really cool, though, is that during that time period, even in the 1830s, that question about female nurses' morality actually makes its way into national politics. Andrew Jackson's mother was a nurse during the American Revolution. And during the 1828 election, the John Quincy Adams camp, who he was running against, was just going after Andrew Jackson's mom. Andrew Jackson's mom was absolutely a prostitute during the American Civil War. And that election had a tremendous amount of wonderful mudslinging. It was fantastic. But the best part was, Andrew Jackson's mom's a prostitute. Because
did they actually say that?
Probably worse.
Okay, well, I know, but I mean, they didn't say she was a nurse, so that means it was like she was. Yeah, okay. So it's like politics today.
Oh yeah, absolutely. Yeah. Now the Jackson camp did hit back the Jackson camp fired back at Adams, saying that he wore silk underwear because he was a dandy and not get your hands dirty kind of a guy and stuff like that. So
I love politics.
This was a wonderful election. But when you get to the Civil War, though, there's a absolute loss of able-bodied men. Those guys are being pressed into the military. They're being drafted. And so women are going to enter nursing at a really, really high rate. And I don't know if women kind of dominate the profession, right there with the Civil War, or if it just kind of like slacks off. I've never reached out into that, but it's kind of cool though. Like, teachers do the same thing. K through 12 teachers, that was a male-dominated profession. This is going to also argue Sheila, definitely. It was thought of that women could not be in charge of small children.
They can have them, but they can't do anything with them when they do. They can change diapers, but after that...
it's so strange that women are mothers and that have that reputation. But the idea was that women could not control small children.
It's really good that Mitchell's not here today because I would have a lot to say to him about being a man on the way home.
Is he going to get it here?
He might.
So, but yeah, it's kind of neat to me anyway. It's neat that it stays there until maybe 1980, 1990, when you're starting to see a little bit more in the way of men nurses. And then I know it's going to be a correlation, it's not causation kind of a thing, but the movie Meet the Parents comes out in the year 2000, where you were talking earlier about those numbers are changing. I kind of wonder if Robert De Niro giving Ben Stiller an absolute hard time about being a male nurse, and Ben Stiller defending it in the movie kind of made it more acceptable for men to be nurses. I wonder if that's
do you think it
literature?
You don't think so? Yes. Okay. So you think that he wasn't necessarily standing up for the ones that already were, more than just paving the way for more.
I kind of think maybe.
Okay.
And
I love that movie.
Yeah, I do too. And I it's probably definitely not, this is the thing that changed, nursing, gender ideology or anything. I think it kind of chipped a little bit away.
Well, but popular culture does that.
Yeah,
so.
Sure.
Mm-hmm. Yeah. And as I was telling you beforehand, when I went through my program in 80, I had three males in my class, and they were there to get an advanced degree. Mm-hmm. They were not, their plan was not to be bedside nurses. Their plan was to go to anesthesia school. Mm-hmm. And that was, and they did. They were successful. But even in the 70s, 60s, male nurses, and there were very few, but it was just the thought that if you were a male nurse, it was because you were not smart enough to be a physician.
Oh,
that makes sense too.
So that mindset had to change, and so that takes a while, like you said. Popular culture has to change, and I don't think we see that now. But certainly with some of the older population, they probably still have that mindset to a degree, because there's still issues, there for males in nursing. But I think, they're looked at much differently today, and men go into it, I believe, to be, they want to be a nurse. That's their calling. They want to be a nurse, and not necessarily, a nurse anesthetist or something like that, So
I personally believe that if I had had a male nurse for having a child, I would have probably would have been more interested, because I just heard all these stories, and I happen to know a nurse that does this. She had to get out of the, doing the birth stuff, because she would say stuff like, they're whining and crying about, I heard her say this, they're whining and crying about having a baby, and they shouldn't have gotten pregnant if they didn't want to have one. Well, see, I think men would be more empathetic, because, they're like, oh, my goodness, I could never do that. So it might be better off. I'm not better off.
And I think it's fair to say that men still gravitate towards certain areas of nursing.
Yeah.
Like I don't think I've ever met a male OB nurse. I'm sure there are those out there.
I think there probably are. I've heard people say that.
Right.
I don't know.
I actually spent most of my RN nursing career at Women's and Children's Hospital, which a large part of the hospital is, peripartum, antepartum, OB, labor and delivery. And you couldn't, other than the fathers who were there, I don't think there are any males who worked in any of those departments. We had males in pediatric and neonatal ICU and the ER. But so I think there is still a lot of discrepancy between units that males would feel welcome in versus not.
Okay.
And even as a male nursing student, that's a big thing when you'd go do your OB rotation. It's almost unusual if you actually get to see a birth, because nobody nobody wants male students in the room. So there's still some discrepancy there.
And that's also, I can't imagine, I can't imagine that's a very sensitive moment. Like for me to rip my arm open, or hopefully I don't. But that's like, if you want to have somebody come in and show people that, but the whole birth issue is a little bit more.
I don't think you want an audience.
Yeah.
Oh, understand. Oh no, I'm not suggesting it should be anything different.
Oh, I know
Totally
that. I know what you're saying.
Right.
Yeah,
Totally understandable.
You're just not going to have that, and it's a good thing.
But you do see moms, laboring moms, a little more willing to let people in. Some are like, absolutely not, male or female. No, I don't want an audience. But some, society's changing, culture changes.
Absolutely.
It's not prevalent, but you do
but
see
I
a
think
little
it'll be more and more, and it may be, and I'm probably going to irritate somebody, but it may be more prevalent to not have them in the South because of
we are a lot more reserved down here.
We are more reserved and
reluctant to change.
We have that genteel nature, gentility reigns for some people, not for me, but for some.
Yeah.
You can say it out loud.
Me either.
Yes. Thank you. Gotcha.
All right. Oh, well, Sheila, do you want to kind of
I didn't
literature?
know. I kind of, like I said, took a tangent, but I will say this. This is why it happened. But first, let me say that, of course, probably the most famous writer in America that was a male nurse is Walt Whitman. And so, and he has a poem, The Wound Dresser, but he served as a nurse during the American Civil War. What happened was his brother was fighting, and he had become wounded in battle, and he was recovering in a hospital in Fredericksburg, Virginia. And so Whitman rushed to his aid. Whitman is the man that gives us the American everyman. Mm-hmm. So he goes to help, and his brother's injury was basically superficial. And it was a jaw wound, but I think about a superficial jaw wound in the American Civil War, not like a superficial jaw wound today.
That sounds.
So it's but anyway, Whitman was so moved by this and by what he saw that he hopped a train to Washington, D.C., where he stayed for 3 years as a volunteer nurse. And he later referred to himself not as a nurse, but a visitor and consolatory. So, and he said these are his words, he was bringing soothing invigoration to the soldiers, which I thought was a nice way to say it.
Yeah.
And he described it in several famous poems. He described it in one of his famous poems called Drum Taps, but The Wound Dresser is probably the one that most students might know. The Wound Dresser's description of what he deemed significant to the nursing profession at the time of the poem's composition. He describes the devotion, sacrifice, and compassion that is essential to this noble profession. And the descriptions of the wounded soldiers in the poem, those descriptions are very authentic, because he was, the American everyman, and he had enough nursing experience to be authentic, and he had intimate knowledge to be of the hospital scene for wounded soldiers. And what I like to tell my students, and if I'm wrong, y'all just correct me, okay? But I tell my students that it's right after the Civil War that Joseph Lister learns about germs. And so that's too bad. I mean, I'm glad he did, but boy, it would have been nice. We probably wouldn't have had as many legs amputated. But anyway, I just took one excerpt from his poem, and I thought everybody might like this. This is from The Wounded. Bearing the bandages, water and sponge, straight and swift to my wounded I go, where they lie on the ground after the battle brought in, where their priceless blood reddens the ground. And so, it's very descriptive, and a moving part of the whole poem is, and what that led me to is the first thing when I was looking of the kinds of things I want to talk about with y'all, that the first line that I got, and it was not attributed to anybody, but luckily I happen to know who it should go to. But anyway, the first thing I got was, fictional nurses continue to be predominantly female. The term nurse and woman are almost synonymous. Well, there was no, and it said, as a result, male nurses currently constitute between 6 to 8% of nursing workforce in the USA. Anyway, so I thought it reminded me of, this is where I go on a tangent, so I'm sorry. Okay. But I just got to.
Go ahead, go.
Because I think y'all will maybe like it, or maybe you'll just hate it, and it's fine either way. Okay. But the person who said that was a famous American literature critic named Leslie Fiedler. And Leslie Fiedler is best described, and this is how I would describe him, as the provocative American literary critic. So he always made you think way outside the box. So he wrote a very well-known, if you have a classic literary degree from, say, I would say mostly baby boomers, and I have to say it, baby boomers, it kind of irritates me because I was never a baby boomer until recently, and they just tagged us on in because we were in nothing. We were just in a gap. And so all the baby boomer talk, and I was like, well, I'm not one. And then all of a sudden, they just threw us in there.
They threw your birth year in there.
Yeah. So anyway, but all the baby boomers read this, and of course I did. So I guess I'm a baby boomer. But it's called, it's about Huck Finn, and it's called Come Back to the Rap, Huck Honey. And what it is it's he sets up the idea that becomes a recurrent theme in American literature. And so this is how I think it kind of fits the idea of nursing. It's all about males. And he says that there was this recurrent theme in all great American literature of an unspoken homoerotic relationship between men. Well, men nursing men kind of works there. And, we're not talking about homosexual. We're saying that men loved one another in a way that they understood each other, So that could preclude them, or it could include them because the soldiers were men. So, or they can say, well, they could never do that. And so there's a whole bunch of there's a whole bunch of male bonding in American literature. And his famous book, Fiedler's, is Love and Death in the American Novel. And in that, he talks a whole lot about homoeroticism. So I decided I would ask y'all this, see how many of these. I think you're going to know a lot of them. It's not a test. Okay. I'm not giving you a test.
Okay.
Yeah. But anyway, he's one of the first, and then there were critics that followed in his path to say that there's a whole bunch of American literature that explore race, gender, and sexuality. And it's where these pairs of men go off into the wilderness of America, and they hang out together and become really good friends. And the pairing is a WASP, a white Anglo-Saxon Protestant, and what critics and he termed the other, anything that's not a WASP. And that's first set up by James Fenimore Cooper in The Last of the Mohicans, where you have Hawkeye, and he goes with the last Mohican chief into the wilderness, and they depend on each other. And Fiedler says it's sort of a, hey, man, I really admire you and everything you can do, and you admire me. So this is where the fun comes in. Okay, so if James Fenimore Cooper, hardly anybody, at least anybody I know, reads him, but he did set up that pairing. Okay, so then I said, okay, let me see how many of these I can think of. Okay, of course, Huck and Jim. And, in that, some people write that Jim becomes a father figure, but he takes care of Huck, even though he's a slave and African American. He takes care of Huck in the way that Huck's father never does. His father is just awful. And that's the best thing I can say about him. I could say a lot of other things, but I won't. But anyway, so let me, y'all just try for a minute to think of movies, because that has gone on. It's still going on today. That pairing of two men.
Buddy films.
Yeah, the buddy films. So I'm going to start with The Lone Ranger and Tonto. Okay, so that's not, I mean, it's a film, but it's also a show. So anybody got any? Think Star Trek. John.
Oh, I was going medical in the 70s, Mother, Jugs, and Speed.
Yeah, there you go. There you go. Yes, good. That's a good one.
Excuse me.
But if you think about sci-fi does it too. They carry that whole thing on with Kirk and Spock.
Yeah.
And then you've got Han Solo and Chewbacca.
Oh, sure.
And then Pulp Fiction. This is where the quiz comes in. Who's in Pulp Fiction?
John Travolta, Samuel L. Jackson.
Yes, good for you. See, I had to look these up because I knew the films, but I thought, okay, what is his name? Okay, so Pulp Fiction. Did we just do that one?
Yeah.
Yes, okay. Stir Crazy.
Gene Wilder and Richard Pryor.
Yeah.
Yes, okay. Lethal Weapon.
Danny Glover.
And
Mel Gibson.
Yes. Okay.
I was going to say crazy guy.
yeah, exactly. That's what I thought. Neo-Nazi, something. Let's see. Here's one you're not going to like, John, but I had to put it in just for me.
Okay.
The Cowboys. Do y'all know the Cowboys? You know who the John Wayne
and Bruce Dern and
Bruce Dern's bad guy.
He's
but
bad guy.
Remember the cook that he
that they
Roscoe. Roscoe Lee Brown.
Roscoe Lee Brown.
Yes. Which reminds me, I didn't even put this in the Dirty Dozen, in there. Okay, but that's not necessarily, buddy. 48 Hours. My favorite.
That's Nick Nolte and
Eddie Murphy.
Eddie Murphy.
Yes, good for you. Okay.
My sister says I'm a wealth of useless knowledge, so that's why I'm spouting this
Hey,
off.
that's me.
She'd be so proud of me.
That's me. We should start a podcast together. Bye, John. Okay, so mine would be called The Wealth of Useless Knowledge. The problem at my age now is I have to write it down because I can't remember the useless knowledge I had.
Yeah.
But anyway, so that sort of that male bonding, I just thought about how that kind of fits with this whole idea of the American Civil War. And not only did the soldiers help each other, they bonded. And, that reminded me, too, because I read this book when I was a kid. And it's really quite a different story. The Gone with the Wind book.
Mm-hmm.
In that book, I think they do it in the movie too, but I'm not sure. They take the wounded guy to the House of Ill Repute to actually get him out of the sight of the soldiers or the people.
Okay.
And this is after the war. Do you remember, if you know that book or know the movie at all, but they take him there, and I think it's Scarlett's husband, and he's maybe dead or maybe not. I don't know. But anyway, she had a lot of husbands. So, anyway, it was interesting because she was the closest thing they had to hiding him and putting him with somebody who could take care of him. So that's kind of cool too. But anyway, so I told you I was going on a tangent here, but I think it's neat how that whole, so I had a question for you about that. With other male nurses, I'm not talking homoerotic. I'm just saying, do y'all have a lot of things that you can talk about and how it's different, do you think, from female nurses talking? Or is your relationship with the female nurses the same kind of as it is with the male nurses? Because I know in my career, and I've been here, well, I came with the building. So when like I've had what I call a lot of male friends that are teachers, and I tend to gravitate toward them more than female. I have a lot of female professors that I'm also friends with. Maybe a personality thing, but what do you think?
But it's really interesting. I think there is probably, now this is just based on my own experience,
Sure.
which was mostly working in, like I said, the pediatric world. But I would say there was a little bit different relationship between, I guess there was only one other male nurse, and then some of the respiratory therapists were nurses. Mm-hmm. There probably is a difference in how we interacted. Almost, I mean, it's ridiculous for a white male to say anything about being a minority, but in that particular setting we were the minority, and so there was a little bit of a bond there probably. And I'll take it one step further too. I am gay, so that may have actually influenced how I felt more comfortable interacting with people and not. So, it may be that the straight male nurses were not even as comfortable interacting with me as the female ones would have been. So you can throw that element in there too.
Yeah, that's true. Yeah. That's a whole different ball game.
Sure.
And, a lot of people misread that homoeroticism as something that is gay, and it's not. He's just saying men like hanging out with men. Well, yeah.
Sure.
We do. I mean, we want to build a water slide off the top of the building. Sure. I mean, and the women in our lives are like pointing out, you will break something if you do this. But we're like, we don't have that part of our brains.
Yeah. Except for me, and I'd be, yes, do it. I want to see who breaks something first. I had all brothers,
Well, there is literature out there that talks about some of the difficulties that male nurses have.
Sure.
There's still some gender discrimination. They still are reports of males feeling a disrespect from their female peers. Also with their, their supervisors, their female supervisors and things like that. And as well as from patients. There are some patients, and we've already, touched on that they prefer a female nurse. The males are the doctors. And, of course, we can go down that road too. That's not always the case anymore. Yeah. So the discrimination is still out there, but the diversity in those numbers changing can only improve that. I really think it can.
Yeah. The other fact that I thought was interesting, it kind of makes sense in some ways. Just on sight, I don't know, y'all could probably speak to this more. But the other fact that I saw is that most male nurses are in psychiatric hospitals. Or there are more male nurses. That's not how to say that. There are more male nurses in psychiatric hospitals than anywhere else. And I always thought that might be because, there's sometimes when people have fits or whatever, they've got to be strong enough to handle it. I'm not saying women couldn't, but it seems more likely. I know I couldn't, but,
Sure.
I
would say that's the only, I would not say I've ever faced any kind of discrimination as a male nurse at all. Yeah. I mean, other than the occasional patient who prefers male or female, but there is definitely a thing about being a male nurse and being expected to be the one who handles the violent patient and who,
I'm sure.
Yeah.
Kind of doing stereotypes on that. I don't know if you guys watched Nurse Jackie, but on the show Nurse Jackie, and I can't remember the actor's name, but Thor was this big, physically huge dude. And anytime they had a problem with a patient that was acting out, call Thor, and he even has this kind of Viking, God name, and roll with that. So that's
sure.
Well, that's interesting. But that's one thing I read, and then it reminded me. I had this really fine student several years ago, and he was actually a writer and wrote very well and won some national prizes. But he was a great big football player guy, but he didn't play football because he wasn't rugged. He was a writer. He was much more likely to want to read and write than go out and play football. But anyway, he was hired, and he was not a nurse. He was just a helper. And there's probably a term for that. But anyway, he worked in Decatur in the psych ward. And I said, well, I know why they hired you, because, he was so tall and big and everything. And he said he enjoyed the work, but he didn't want to do it for his whole life,
Right.
But it does kind of make sense. And then I think about, like, Nurse Ratched, in One Flew Over the Cuckoo's Nest. And so she was pretty tough, but it sort of makes sense. So I imagine if, I would be the one, I'd be saying, I'm a feminist, but I'd be saying, hey, help me over here, because I'm not big enough to handle that.
And in a way, it does make sense. And going back to the whole stereotypical male personality thing, when something like that happens, you kind of do want to be the one that's like, well, not on my unit, But when you really get down to it, I don't have any more training or equipment or any, anything than any other nurse. And really, I don't think any nurse should be expected to be exposed to violence.
I agree.
So it's in a way it makes sense, but in a way it's very unfair also.
Yeah.
Yeah.
Well, is there anything that you would say needs to be done to prevent nurses to not be exposed? Like, should there be people that are there just for that? Because you never know, right? I mean, it can happen
you never
at any
know.
time.
Sure. And there are. I mean, hospital security, that's what they're
Okay, that's what they're there for.
So
Okay,
really the
good.
correct move is to step back and let them handle it.
Yeah.
And I've seen community police come into the hospital for that kind of thing as well. But I will say it is so common that it's almost impractical to call security anytime somebody's acting a fool, because they frequently act a fool.
Yeah. And that's patience, right?
Yes, correct.
Yeah, because I'm sure that you have other people acting crazy.
Sure.
That are just with patients.
Sure, and it's a little bit easier to get them out if they are a threat, but you still have to take care of the foolish patients in addition to the not foolish ones,
I think it's interesting because I think I would have a hard time with that, not only for the medical reasons, but also just not knowing what was coming next. That would kind of worry me. I kind of know exactly how my day's going to go, pretty much. I mean, nobody can know for sure, but I know, I'm going to teach these people.
Oh, yeah.
Going to do this. And,
You have to be flexible.
Right. Right.
Sure.
So, yeah.
Is that something that maybe drew you both into that just sort of unpredictability on a day-to-day basis, or?
I would say so for me, which I got into EMS when I was really young in high school. And I was all about the adrenaline and the, let me handle the worst of the worst. And now I'm 40 and I'm not, I hand out cholesterol medicine all day. I don't necessarily need to be in those adrenaline situations anymore. But that probably was part of what drew me.
Yeah. And me too. I mean, I liked the variety.
Right.
It wasn't the same thing every day.
Right.
And people are so different. You never knew what you would get from a day-to-day basis, So, that's one of the things that I really enjoyed about.
Yeah, that is
when
so
I was
cool
at
for
the
you to
bedside.
say that, because I've often thought I liked variety, but your variety, what you like, is different.
Way different from ours.
Yeah, I like the variety within a format.
Yes.
You just like variety, which is really cool.
Yeah.
I'm not that person. But that would be cool if
And that's
I were.
and that's what we struggle with our students, is to let them know and get them to understand they can't think the same thing every day about every patient.
Right.
2 and 2 is not always 4 in nursing or in healthcare.
Right, right.
Sometimes it's 3, sometimes it's 5. And there's so much gray, and so it's a different way of thinking, a different way of approaching things, and so getting them to see that and understand that and practice that, it's difficult sometimes, but they get there. They get
I like
there.
that. Yeah, it's interesting.
I've got probably 2 questions, and they're both related. And one one of the things that Sheila and I have started actually this week is we're doing one episode as just medical stories. And it's focused on faculty, any faculty that we can kind of trick into coming in and talking about themselves, because like something that you just mentioned a second ago, that the different patients respond to different things and stuff like that. And that's kind of where we were going. And the thing that I talked about on that episode was when I first got to Calhoun about a year after I had been here, we were moving house. And I thought that I had a hold of a file cabinet and it was good. And I didn't. And my left knee, I just popped the ACL and ripped the MCL. And the weirdest thing was it didn't hurt. And I went to the ER and they were like, yeah, you've done this. And then I went to the orthopedist and I was telling him about it. He was like, wow, you are so tough, because like that didn't hurt. And I was like, no, it just didn't kick on in my head that it hurt. It looked painful, but for some reason with me, it just didn't register.
Yeah.
Without violating HIPAA. Yeah, there we go. Without violating HIPAA, don't do that. But what's like a weird, unusual kind of case like that maybe that you guys have seen?
Oh, gosh.
Oh, man.
I'm terrible at this game.
Sorry. This just popped into my head while we were sitting here, so I didn't mean to put you on the spot or anything.
Well, I've got one
Okay.
to ask about, too. On top of that, it might be easier because it might narrow it down a little bit. Can you tell that some people have a much higher tolerance for pain than others?
Mm-hmm.
Yes.
So
yes.
what's a situation, if you can tell us, somebody that you thought had the most incredible tolerance for pain?
Well, I worked for several years in a urology office in Athens, and I don't know if you know.
Squirm.
I don't know if you know this, but kidney stones is very prevalent in North Alabama. Very
Yes,
prevalent.
my husband has had
So
them.
we would have patients that would come in with kidney stones, and I have seen some of the biggest, rugged, to use your word, biggest guys you can imagine, who you would think could not be any tougher, be in the floor, squalling like babies.
Mm-hmm.
And then the women walk in holding their back going, good Lord, my back is hurting. So there's just so there's that women toughness versus, it's just your expectation of, and if your expectations are not always, not always accurate.
Yeah, what you think you're going to get.
What you think you're going to get, that stereotypical kind of thing.
Let me reiterate, women have babies.
Women have babies.
They can handle a kidney stone. I have a friend that has kidney stones. She actually works here. She has kidney stones quite often, and she'll come to work and say, well, I got a kidney stone. And when my husband had the only one he's ever had, and he's a big guy, and he was like, oh, I don't know what's wrong with him. And I mean, he's not the kind of person that gives into pain very much. But boy, that day I thought he's going to die today.
Sure.
It scared me.
It's very scary. It's very scary.
Yeah, I imagine. And it seems like it's situational. Like that, my knee didn't hurt, but like, guys, I am not a tough individual. Like, if you were to slap me in the nose, I would probably tear up really easy. It's just that. And so it's like, big traumatic thing that seems scary. My brain's like, no, you can't handle any of that.
yeah. It's just that, unfortunately, it's just our, there's a word it's not coming to me, but just stereotypical thoughts about, this is what I expect. And this is not always what you say.
Oh, absolutely.
But people are funny. People are funny. And I enjoy their differences, and because you never know what you're going to get. You don't know if this patient's going to be on the floor or if they're going to just be going, ooh, I got a cramp. You just never know. So, variety. I love it.
I might be able to cover both of your questions at once. We used to have this little girl when I worked in recovery at Women's and Children's that would come in that had some sort of, I don't know if there was a name for it, but she has some sort of congenital condition where she just doesn't feel pain. And so she would come in with broken bones
Oh, wow.
have to get them fixed. I mean, multiple times during the time that I worked there. And, she was covered in wounds and things because she'd be, she was a normal kid. Otherwise, she'd be out playing and doing whatever. And she'd come in with her arm flopping around and they'd go, oh, looks like you broke your arm. I guess we better go to the hospital. And I'll tell you, she was the best patient to take care of after surgery because she was fine. She woke up and everything was cool and she got to go home. But that's probably one of the more unusual situations I've been involved with, but that also involved the pain tolerance situation.
Yeah.
I guess you could look at it as she's either very lucky or very unlucky to have that superpower.
I think that for me, that would be very unlucky because it would be like I'm going to throw myself off the roof because I can.
Sure.
Yeah.
And
yes, John, that's you.
Yes. and I've always wondered she was roughly 9 or 10 at the time. So I've always wondered what, the rest of her life was going to be like with that.
Yeah, I think that's interesting because if that is, like you said, you'd throw yourself off the roof, I would probably hurt myself. And then I would just say, oh, that's fine. It'll be fine. And that might really need something, like an arm set.
Yeah.
And I just think, well, I can do without that for a while.
and we see that. People who,
I'm sure.
They wait to go to the hospital after an injury.
Yeah, because I'm one of them.
Yeah.
Sure.
So...
When I will tell you in general, if you ever wonder who has the high pain tolerance, it's not the people who say, I have a very high pain tolerance.
Oh, yeah.
Ever notice that?
Yes.
Yes. That's a key right there.
No, you don't really.
Yeah. You just think you do.
Which is always followed by, but.
Well, and also, there's no way to know.
Sure.
Yeah.
From yourself, I know what I might think I can stand or what I've withstood. But compared to other people,
sure.
It's hard to know.
Sure.
You're your own individual.
That's that variety again.
There's that variety. Yes, ma'am.
Makes sense.
So
very, very cool. Since you are both, are we about ready to wrap up? Do you have any more questions?
No, I did my stuff.
Do you guys have anything that you sort of just want to speak out into the world?
I do have a little interesting point about the whole gender of doctors and nurses thing, to go back to what you were saying a little bit earlier. So I took over a practice from a female physician. So, and a lot of her patients were very they wanted a female doctor. And when we took over that practice, we tried to find a physician to come in and take over it, but we could not. So not only were they going from female to male, they were going from physician to nurse practitioner. And so it's been a very interesting case study in that whole gender dynamic thing in my little practice. We have people that don't care. We have people that have left because they really wanted a female. And it's very interesting to me to notice how many of her former patients will when they're speaking about her, they will call her Miss Emily.
Oh yeah.
Or Miss McClure. She's a doctor, she's Dr. McClure. And then patients also will call me Dr. Jody or Dr. Marks, and I'm not, I'm a nurse practitioner. I don't have any kind of doctorate degree. But people will still refer to me as doctor, now I don't pretend to be. They know I'm not a doctor. I don't pretend to be a doctor.
Right.
But that's a very interesting little case study in that whole gender situation.
My big thing about that is that this just kills me. I don't know if I've said it on here before, but one of the things, and Dr. Ray feels the same way. I think she'll be okay with me saying this about her because we're friends. If she's not, she can just tell me. Don't ever do that again. But anyway, we have students that you can say on the syllabus, Dr. Byrd, whatever. They will call me Miss every time. Same with her. And I think she has told classes, I've never done this, but she's told classes before, look, I worked hard to get that, and I want you to call me doctor.
Yeah.
Right, absolutely.
But we've heard the same thing all of our lives, that every man is a doctor here. And there are lots that are not, and that's okay. I'm just saying it's such a stereotypical thing that hasn't left yet.
No,
and actually,
that's very true.
One thing that I don't like about our email here, is that it has our first name on it, which I don't care if people know my first name, but the fact that it just says Sheila Byrd, Well, the thing about it is, it leads now students, and I think it comes from maybe kindergarten, I don't know, they have actually referred to me as Miss Sheila.
Wow.
And so the last time a girl said that, and this just popped out of my mouth, I didn't mean to embarrass her, but I said, I am your professor, not a palm reader. Because Miss Sheila sounds like somebody that reads, oh, I'm going to tell your fortune. Yeah, here, give me your hand, I'm going to tell your fortune. I just couldn't believe it.
Since you mentioned that, it reminded me, I have been called Dr. John, which sounds like I need to go and start a blues band,
Yeah,
which
I was
I
gonna say,
absolutely will.
that would be a fun thing to do.
Yeah, I've gotten Dr. John on that, and I was kind of wondering where I got that from. But yeah, it must be the same Miss Sheila, Dr. John.
Yeah,
Because,
I wonder if in high school, see, I do think you shouldn't call your teacher. I'm just old school that way. I don't think you should call your teacher by their first name.
Yeah.
Even if you put Dr. or Mr. or Ms. or Mrs., which they don't know the difference in anyway.
Yeah.
So I don't get it. You know, I think that's really odd.
Sure, I agree.
And if somebody wants to do that, hey, good for you. I'm just not one of them.
yeah.
You
Sure.
know.
Yeah.
And it's very odd. Do you get anything like that, Mom?
I get some of that, not a lot. No.
But I'm glad you brought that up because I know that happens. It just surprises me that it's still happening,
Right.
Yeah.
you know, after all these years. I mean, it happened all the time when I first got here, but, you know, we're talking 30 plus years.
Mm-hmm.
Sure.
So, and it's still happening.
Yeah,
But it's
female
gotten worse because
professors
now
get that a lot
it's Miss
more.
Sheila.
Yeah.
Well, it's just the I think it's the change in our communication practices.
Sure.
Everything is done with
Yes.
you know
texting
and things like
Email
that
and-
instead of face to face, and so there's
Yeah.
a familiarity
And a
I feel,
casualness, yes.
and a casualness with that texting
Yes.
that you know most of us don't have that casualness when we're talking to. And we do if it's a peer,
Right.
but we're not peers.
But generally, I don't talk to my students about, well, I never call her Ms. Ray because I never have. I never say, well, if you have Ms. Ray or if you're going to have Leanne, I don't say that. I say, if you're going to have Dr. Ray, you can take this and this and this. So, or anybody else, you know.
Sure.
And it's just odd to me for that to just come out of Miss Sheila, really?
Sure, it is odd. Unless somebody's giving you permission, like, please just call me my first name. Right.
Yeah. And that's fine.
Right.
I'm just not going to do it.
No, right. Nobody should assume that.
Yeah.
Right.
Well, see, Jody was my student in the bridge program, and I cannot get him to call me Stacy
No.
to save my life. He won't do. He's a peer. He's
Yes.
a peer.
I have the same thing.
He said, "I'm sorry, I can't do it." I said, "It's
absolutely
okay." He won't do it.
I've taught a lot of people that are here now, not necessarily to just all over, and they still call me Dr. Byrd, and I'm like, don't do that. And I had students that are at other places now at schools teaching and everything, and they will still, and I'll say, don't do that. It's okay. I mean, you've spent the night at my house, really.
It's okay.
Come on, it's okay.
Oh, I'm sorry, you're stuck. My advisors are Dr. Barr and Dr. Carlson.
Oh, I
And
understand
you're
because
permanently Dr. Barr and Dr. Carlson.
Dr.
Yeah.
McGlynn, who has already passed away, who was one of my favorite teachers, I still refer to her as Dr. McGlynn. And I mean, I spent the night at her house. We went places together. We were friends afterwards, but I could not call her. I can't even say her name on the air because
Sure.
she will always be Dr. McGlynn.
Yeah.
Sure. The physician I work with is somebody that I grew up with. We played baseball together, you know, in Little League. We're the same age. In every other way, we're peers, but he's a physician. He's my boss. So at work, he's Dr. James. It's not.
Yeah.
Well, of course.
Right.
Yeah, it makes sense.
Yeah.
And that's probably something we should push a little bit. You know, I mean, our students sometimes need to know that.
Sure.
You know, so and I try to do it in a not, you know, in not a negative way. It's hard not to do it in I'm not, you know, I
It's
hate
hard to
doing
say.
it that way.
Yeah.
So I just always try to make it funny and say, don't do that.
Well, it's just basic respect, I think. And I
Yeah.
even go out of my way. You know, we have patients who have PhDs and are dentists and chiropractors and whatever. And I go out of my way to address them as doctor. And in that particular dynamic, I probably don't have to, but
well, you know, but
they are a doctor and I'm not, so I'm more conscious of it, I guess.
One of the nicest things that I ever experienced, which I thought was fantastic, of course, he was a great doctor. My rheumatologist, who has since retired, used to refer to me as Dr. Byrd, and I would say, "Oh, don't do that. I'm not a medical doctor, you know." And he would say, "Well, we just talk a lot about literature, so I feel like I should call you Dr. Byrd." I thought that was kind of him and unusual in some ways, you know.
Sure.
Yeah.
So,
I like to say that we are the kind of doctors that don't help people.
yeah.
Not true.
Not true. That's true. Yeah, it's not true.
I like it though.
I do too. It's kind of squirrely.
True or not true?
All right. Well, the last thing that we do every episode is you guys, since we have two guests, you guys get to pick which color dye you
All right.
want.
Pick one, Jody.
Well, you
No,
both
please,
have
Dr.
to roll.
Powell, you first.
There he goes.
Purple. All right.
Okay, and
Just roll it in that box when it's time.
Okay.
Yeah, I'm going to ask you a question. I'm sorry, but if you guys get a heavy question, you're just going to be required to answer it.
I'm up for it.
No,
Let's do it.
John, why are you saying that?
Because they have interesting history stuff.
Okay.
Oh Lord. Okay.
See, sometimes he says if you get a question that kind of breaks your heart or whatever you don't want to talk about, you can get a pass on it. So I'm going to make him do that.
Okay.
So, yes.
There is one question that if it's if I read it and you get that one and you're like, nope, I will just we'll throw another.
We'll do a different one.
All right.
All right.
He was going to throw y'all under the bus.
Is that what it was? Oh my God. Okay.
All right. So whichever one of you like to roll first.
Number 4.
4. Okay. Tell us something embarrassing or silly about yourself. And now, just before you go, Sheila and I did an entire episode where we answered every single one of these. So,
Oh my Lord, something embarrassing or silly about me. Wow, I'm nervous. Probably, I don't know that it's embarrassing.
well, that's why I put silly, because
Well, there back in 1999, 2000 era when the Backstreet Boys were very, very popular, I was a huge Backstreet Boy fan. Me and Ginger West, we traveled all over the country to Backstreet Boys concerts.
Oh, cool.
All
And
right.
we were the oldest people in the entire auditoriums, stadiums, whatever it was. And there's actually a teen magazine that has me in the audience.
Really? Do you have a copy of it?
I do. Yes.
That's so cool.
Yes.
I like it.
Of course, Ginger was mad because she wasn't there, and she was right beside me, but they cut her out, and I was there. So,
Well,
yes.
you were the star.
I was. Apparently, I was.
Yeah, there we go.
So that's now I look back on that. I'm like, that's kind of silly, but boy, we had a good time when we were traveling.
yeah.
So.
Hey, look, weird thing about me is I can shoot a bird with both feet, with both of my feet, my toes. I can shoot a bird.
Oh, okay.
So,
I
you
can't
know,
do
that can't be any more embarrassing than that.
I'm still a huge Backstreet Boys fan.
I
That's my
love it.
go-to,
Yeah,
for working out.
There
Love
you
it.
go.
Love
There
it.
you go.
Yeah.
all right. Well, Jody, you're
turn.
up.
12.
Oh, and you got the heavy
I got the heavy one.
Oh,
Let's do it.
gosh. All right.
I'm not shying away from it.
Now,
I
if
don't want
you
to get any
don't,
tears on your microphone.
That's okay.
I'm not shying away from it.
is there a particular topic that you cover in class that breaks your heart or is difficult for you to get through?
Sure. Yeah. Anything that involves kids.
Yeah.
Anything that involves children.
Oh, yeah.
Yeah, it's going to happen right now, probably.
Oh.
We just covered SIDS, sudden infant death syndrome in class the other night. And I had to stop several times, which I can't keep emotion out of my voice.
Oh,
I don't know how people sing and perform, in emotional situations and keep talking. I can't do it. But yes, I was up there crying in front of the whole class. I had to stop several times.
I've got a couple of lectures like that, but it just
Which I think is interesting because he worked PDR and has worked with children and,
I see.
Pete's ICU.
Yeah.
I'm sorry.
Well, no, I think that is why. I mean, I don't have children.
Yeah.
I know a lot of medical people struggle with, they deal with a kid and they think about their own children.
Right.
I don't have that.
Yeah.
But, I've been around my share of pediatric deaths and bad things happening to kids. And so I think probably that experience is why it affects me more emotionally, because otherwise it would just be something reading out of a textbook. And it says blah, 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 blah. But,
But
I have
it
experienced
shows
some
the
of that.
most important thing is empathy. That's what, you know, you've got to have that.
Sure, right.
Yeah.
And it was interesting. One of the students who I don't know came up to me after that lecture and said, "Thank you so much for showing us your humanity and being
Yeah.
real with us."
Yeah,
So,
I had that one time.
I've had that before.
My brother, like, he finished medical school and then he was diagnosed with terminal colorectal cancer.
wow.
And in class, not related except for cancer, I was talking about Nabby Adams, who is John Adams's daughter. She was diagnosed with breast cancer. And there's a really good article if you guys want me to send it to you later. But I was going through her diagnosis and the surgery and stuff in class, and my voice I just kept on breaking. And I had a student afterwards that came up and, you know, she was like, "Thanks for going through that and, you know, talking about that a little bit, because something happened similarly to my mom." And, you know, and I thought that was really super cool. After I was like, "Holy crap," you know, that was neat that I had that student come up.
Yeah.
Right. Yeah. I almost never get any feedback about anything I say, and that's good or bad. So that was a nice moment for that to happen.
Yeah.
Well, very, very cool.
Yeah.
Okay, good.
Oh, all right. Thank you guys so
thank
very
you.
much.
Absolutely. Thank you for having us.
For
Yes.
joining us.
Yeah.
And you know, if you are thinking about going into the nursing program, Calhoun's is excellent. I've heard tremendously good things about it. My son's considering going into nursing, and he's definitely, you know, getting steered here because of how wonderful I've heard about you
Yeah,
guys.
Great.
we hear
Awesome.
great things from students all the time
Wonderful.
about the nursing program.
Good.
Love
Good.
it.
That's great. That's great.
Good.
Right.
Thank you.
Thank you
Thank
very
y'all very
much.
much.
We enjoyed it.
We
Thank
appreciate
you.
it. Thanks.
All right, that does it for this episode of Knowledgeable Provider. I'm your host, Jody Marks. Thank you so much for listening. Don't forget to like or subscribe or follow and leave a nice 5-star review. And as always, stay safe, take care of yourself, and take care of your patients, in that order.